whose name's Dazza, and he's about 2 years old, and we want to get his nails cut.
2-year-old Dazza has a foot phobia.
Well, when I touch his paws, he just goes berserko, like he's doing now, wiggles around, tries to bite me, tries to scratch me. See, he goes berserko. Yeah, whoa.
Claudia named her puggle after Brisbane Broncos rugby league star Darren Lockyer.
Basically like a little baby that doesn't like a needle.
As a result of his foot phobia, Dazza has never had his nails clipped.
I don't think there's anything wrong with his joints. I actually think it's all up here.
Dazza.
You're scared of the crazy woman.
Wheelbarrow.
You'd probably see about 1 in 50 dogs that really freak out about having their nails done.
Ow, I'm gonna get hurt.
Now, Mel, between you and me, he was a lot bigger than he actually is. That's why we can't do it.
And he had a gun.
Yeah, he definitely had a gun.
Dazza has won the battle, but maybe not the war. The other option is sedation. Claudia's going home to decide if she wants to fork out the $100 for the procedure.
It's hoping to make it cheaper, but you know, unfortunately, that's not the way. It's not the way the cookie crumbles.
Retriever Jessie has been hit by a car outside her home.
Good girl. Your mum and dad's with you, you'll be right.
Distraught owners Helen and Barry have brought her into Bondi's referral hospital, Sash.
Oh, I don't think that's a bit sore, isn't it? So I suspect that she's basically got a broken back. That's weird. Yeah, I know that's sore. I mean, she's in a bad way. She's paralysed. She can't move her back legs at all. Thankfully, she can feel her feet, so she actually has sensation in them, and that's a good sign for her recovery. Next step, CT scan. So after that, we'll make a decision where we have to go and what we have to do. The fracture's just in here, and this part of the spine is actually elevated and this part's dropped down. So the spinal cord is basically getting squished between the two. So what we'll have to do is realign it, bring this side up a bit, that side down a bit. I think if we don't do anything, the chances of her walking again are almost nil.
It's terrible when the kids they're all in pain too, you know, knowing that she's not well. And they said to us, forget Christmas this year, just get her better.
Jeff, isn't it?
Yeah, mate.
Hello, Chris, how are you?
Good, mate.
Mate, come straight here.
A 6-month-old boxer, Cross, has been rushed into Bondi Clinic by his owner, Jeff.
What's his name?
His name's Buddy.
Buddy's struggling to breathe and his face is severely swollen.
His face just went woomph like that, all in a matter of 2 or 3 minutes. Because that's a bit swollen, but you can see the colour difference in the eye, obviously. And his lip is like...
That's huge, isn't it?
It's massive on both sides. I feel that.
Yeah.
It's all right, mate.
He's distressed, he's having big trouble getting his air in. This looks like the classical signs of an allergic reaction, and we need to stabilise him and do it very quickly.
And my mother-in-law found a wasp, a tiny little black wasp with a brown body on the kitchen floor that was dead.
Yeah. Buddy, you got to be good for us, okay?
It's all right, mate. I'm here, mate. It's okay. It's okay. It's all right. I'm here.
Just calm down.
Buddy's gone into what we call anaphylactic shock. Now, if that reaction is severe enough, his airways will constrict. If that happens, he won't be able to breathe at all.
What Buddy needs urgently is a cortisone-based drug and an antihistamine to settle his breathing and stop the allergic reaction.
Oh, you still are. Far out.
Hopefully the drugs will do the job in time.
If it doesn't work out, it doesn't work out. If we can just give it a go, it'd be great.
Next on Bondi Vet, will Jessie's spinal surgery be successful?
I guess I so wanted to get her movement back. I don't know whether I'm seeing something or whether it's just, you know, her legs dragging along the ground.
And Buddy's battle continues.
Just keep calm there.
If I can just get your thumb to do that.
Okay. Yep.
That's all I need you to do.
Just put it in, mate, because he won't stay still.
No, we can't go too quickly.
Oh, righto.
Alright. Great, buddy. Thank you, mate. Just keep calm there.
6-month-old Buddy is suffering a severe allergic reaction to a sting from a wasp.
Okay, we're almost done.
Anti-inflammatories are being administered to reduce the dangerous swelling in his airways.
Sounds like he's starting to take deeper breaths here, which is good. His heart rate slowed down a little bit, which implies he's a bit more relaxed.
Yeah.
20 minutes later, and Buddy's condition is slowly improving.
Give the missus a call and give an update.
Jeff's partner Rebecca is waiting anxiously at home with their 1-week-old baby girl, Amelia.
You know how kids have shots to protect themselves? Can you be given something so that if it happens again, that doesn't happen?
It's like, I guess it's like a kid with either a peanut allergy or a bee allergy. All you can really do is just be on hand, watch him where you can. But the moment you see any sort of swelling, just obviously give me a call and we can give him the medication.
I have your number on the fridge.
Well, I'm sure.
He's fine,
He's looking at the phone, wondering why he can hear Mum but can't see us. So.
Oh, little home with his little girl.
But don't worry, he looks like he's going to be okay.
Thank you very, very, very much. I'm very relieved.
All right, no worries at all.
Bye.
Thanks. Bye.
See ya.
No worries.
Well, hopefully he's smart enough not to go near it next time.
It just shows you can't wait around till the next day to see if these things are going to sort themselves out. Jeff acted straight away. As a result, Buddy's alive and one very lucky dog.
Look, if you're worried about him tonight, give me a call. Oh, he'll be fine.
Sweet ass.
Okay.
No worries.
And you sleep well, all right?
Thanks a lot, Chris.
No worries, I'll see you later.
I mean, they're always hard operations. Doesn't matter how many times you do them. You've got to get the pins just in the right spot. If you're too far one way, you end up skewering the spinal cord. If you're too far the other way, you don't get enough bone, and so it's not a secure repair. So I always sweat a bit when I'm doing these ones.
Car accident victim Jessie has been taken straight to surgery to try and fuse her broken back. There are no guarantees the golden retriever will ever walk again. The pins are finally in place. Andrew now mixes up the bone cement, commonly used for human knee replacements and repairing spinal fractures.
This is what's actually going to stabilise the whole fracture.
New CT scans will now show if Jessie's operation has been successful.
I hate this bit, the waiting. I will know very soon. Is that right? That one's good.
It's a little KY.
That one's close, but that one's still, that's perfect. That's just shave the outer edge of the spinal canal with one of those pins. So some would say that's a perfect placement. I would say it's arsey. This is a good result for Jess, yeah. Now her spinal cord's nice and stable, it's decompressed, so she's got the best chance that we could have given her.
You're going to get clipped today. Yes, you are. Oh, yes, you are. No more scratching mummy. No more scratching mummy.
2-year-old Dazza is back at the Bondi Clinic, proudly wearing his Broncos coat. The puggle has resisted all attempts to cut his nails.
I think he does know that he's getting his nails clipped.
Apart from scratching Claudia, Dazza's nails could soon become ingrown. If that happens, even walking would be painful.
Daz, sorry to interrupt you from your toy. We're going to go and sort you out. Is that okay with you?
That's fine. Good luck.
Rules have changed. I've got things on my side. I've got the odds stacked in my favour.
I do like his jacket, but I don't know who they are. Who are they?
Broncos.
Oh.
They play football.
Do they?
Rugby league.
That one.
It's the one with the ball that's not circular.
Dazza's foot phobia has forced Chris to take the extreme measure of sedating him, so his claws can be clipped for the first time.
All big and brave. Show them what you're made of. All right. Oh, it's just a needle. You can't see it. Look, we'll hide your head.
Dazza is making one last stand.
Dr. John.
It's time to get some backup.
I'll distract at the back.
Thank you. Took John to bring down Darren Lockyer. It's amazing.
A bit of a fearsome beast.
I always find the nails seem to really freak people out because they just don't know where to cut them, and it's not that hard. You can see where the pink quick ends and the whitish nail begins. So you're pretty right just to cut in underneath that. You can see no blood and no pain.
I think he's having a really good dream now. He's really not worried about his feet. What do you think?
I'm just wondering whether he thinks we could possibly do some orthodontic work while we're here.
No, he looks too cute.
Coming up on Bondi Vet, will Jessie ever walk again?
Maybe if we can get her home and just hope something happens and something clicks, and that's what we're praying for.
And Chris is called out to a mother in trouble.
I'm worried like you that if it's in the wrong position, then we've got a big issue here.
Come on, sweetie, you going to go? There you go. I guess I so wanted to get her movement back. I don't know whether I'm seeing something or whether it's just, her legs dragging along the ground. So I try and sort of distance myself from that, but it's difficult.
The next day at Sash, car accident victim Jessie is showing no signs of movement in her back legs.
Come on.
But this doesn't mean the operation has failed. The nerves in Jessie's spine need to reconnect, and that's a matter of waiting for nature to take its course.
You've had a certain expectation of how they should go and knowing full well that it may not go that way, but it doesn't make you feel very good when they're not going how you want them. So, yeah.
It's so different at home without her. It's so quiet.
Get better soon.
Helen and her daughter Kate are refusing to give up hope.
You just want them to be able to say yes or no, like she's going to get up on her legs or she's not. So I know they can't, but I just wish someone could say that.
Hyundai. Ooh, saying thank you.
Dazza's toenails are trimmed, but unfortunately, it's unlikely he'll ever get over his phobia.
In the meantime, what you could try is actually walking him on tarred roads or concrete, just to keep them worn down.
No problem.
And also just play with his feet a lot.
Okay.
Patting him, just pick up his feet and play with them so he gets used to it.
No problem.
All right.
Thank you so much for that. I really appreciate it. Thank you.
No worries. Go the Broncos.
Go the Broncos, yeah.
All right, I'll see you later.
Thank you
Good
very
luck.
much. Bye-bye.
See you, Daz.
Good girl. Hey. Get to go home.
Several days after Jessie's major spinal surgery, Helen and Kate have arrived at Sash to take her home. Sadly, there's been no miraculous improvement.
Maybe if we can get her home and she can smell her own place and she can, everything's familiar. Just hope something happens and something clicks and something just, that's what we're praying for.
Come on, sweetie. There we go. Just need to get those back legs working as well as the front.
Yeah.
Good girl. There you go, good girl. Whoops. There you go. There you go. He says, I'm glad to be going home.
Taking Jessie home is a huge commitment. Helen will have to learn how to keep her catheter clean to stop infections. Jessie will also need physiotherapy sessions 3 times a day.
Stretching them out, flexing them up. It's not that she's a hopeless case, though I think, to be realistic, as we stand now, I think she has more chance of not getting better than she does of getting better, and that's always disappointing.
It's heartbreaking to see.
I'm not going to leave you this time. No.
We're going to work on it and see how we go.
Just had a call from some friends of mine on the outskirts of Sydney. They've got a horse. She was meant to give birth a few days ago and she still hasn't gone. We've got to get there and check out what could be going wrong here. Hey Rachel.
Yeah, hi Chris, how's it going? Thanks for coming.
That's all right, where is she?
She's just down here in the paddock.
Yeah, all right, let's get in there.
Harriet is a valuable breeding mare. Her first 2 foals arrived quickly with no complications. This time, owner Rachel senses something is wrong.
There's a lot of walking, a little bit more than usual. She's sort of tense and a bit worried like, so.
I mean, you know what I'm thinking. I guess I'm worried like you that, I mean, if that foal's not alive or if it's in the wrong position, then we've got a big issue here. Easy girl, easy girl. I guess the worry is if I get too close, then I just don't really want to freak her out here. The foal is that close. If I approach her as that foal's starting to come out and she runs, she's basically going to trample the foal.
Yeah, I'm just so glad Chris is here now, and I just don't want anything to be wrong with the baby, and I certainly don't want anything to go wrong with the mare.
Easy girl. Once this foal starts to come out, the first thing I'm looking for are feet, because the feet are going to tell me if this is a breech position or not. If the feet are front feet and if they're the right way up, coming out like that, then we're fine. If they're back feet, bad news. It's all right. Are you close, girl? Calm down. Calm down.
Next on Bondi Vet, has car accident victim Jessie made a miraculous breakthrough?
Isn't that good?
And will it be good news for Harriet?
When that water finally does break, it's going to happen at a rush. Break, it's going to happen at a rush. And then all of a sudden, we're going to start seeing feet. That's the critical moment. If we see feet, if they're front feet, we're fine. If we see back feet, big trouble. It's a breech position.
Chris has been called to a friend's farm just outside Sydney to help with a difficult foaling. After being overdue by several days, Harriet appears to be finally ready.
Let's go, Larry.
After all the stress, the foal has arrived feet first and seems to be in perfect shape.
Oh, you're welcome. You didn't expect us. Nice and clear. Little girl. Yep. Little filly.
Girl.
Well done, Harriet.
I thought we had a little boy.
Girls can keep you waiting too. Beauty, huh? Made it just in time.
Yeah. Yeah, I'm ecstatic. The foal's healthy, mum's healthy. The baby's not named yet, so that'll be the next thing, I guess, that we have to do.
She's a pro, isn't she, old Harriet?
Yeah, she is. Just having the vets right there when the action's happening takes the worry off my mind and places it on theirs, I guess.
That one there and this one over here.
The next crucial test is for the foal to stand up. She should be taking her first steps within 15 minutes.
I'm really happy with how our filly looks, but the problem is Harriet right now is dripping colostrum out of her udder. She only has a certain amount of that, and it's so rich with antibodies and the proteins and the fats that our little girl needs here. If she doesn't stand up quickly, all that's basically going to run into the ground and be wasted, and she's going to miss out on the most crucial thing she needs right now. So get up, come on. Oh, so close. Give it another go. There we go. Hey, look at you.
Hey, well done.
You're up.
Jess, come on. Come on.
Oh, look at you go.
Come on.
Go, girl.
Yeah.
Hey, Jess. Wow, what a flash pair of wheels you've got.
Good girl.
Jessie, who broke her back in a car accident, is independent again with the help of a custom-built cart.
She looked really proud of herself, and I think she was just happy to be trotting down the corridor, saying, look what I can do.
Oh, she can do about 15, 20 steps on her own.
Oh, really?
On her own,
Oh,
yeah.
I'd like to see that.
Wait.
Just take it
Wait.
easy.
Wait.
Take it easy.
Wait.
Good girl.
Wait.
Good girl.
Wait.
You got your little rudder
To
hand.
get this result, Helen and her family have been giving Jessie up to 5 physiotherapy sessions a day.
Oh, that's good, isn't it?
If they'd have not put the effort in, she'd still be sitting and not be able to use her legs, there's no doubt about it.
Isn't that good?
I think she'll be improving in 6 months, maybe even 12 months' time. It'll take that long.
We love her. She's part of the family, so there was never any other option for us. I'm so glad that we've taken the road we've taken. Good girl.
It's great to see Jessie walking around like that. The other thing is that we've just had news about Rosie.
Rosie, come on. Good girl, come on. Good girl.
It's been 6 months since Rosie underwent major surgery to straighten her deformed legs. This is her first big outing.
In the months sort of following the operation, she's been limited in what she
could do. There have been times when she's off. Yeah. Oh, sorry. Yeah, that's fantastic though. I haven't seen her run like that. Rosie, oh, she's chasing birds. Okay, she could not have done that. And being a golden retriever, I guess that's what she's meant to do. So she did that perfectly on cue for the program. That's perfect.
This is a little bugger that caused so much drama to our little boy, our dog.
It's good news for Buddy the boxer, who's made a complete recovery from his allergic reaction to a wasp.
So we didn't think we'd make it. Just thought we'd been given the most precious gift in the world, and at the same time we were going to lose our little boy, so it was horrible. Thank God for Chris.
That's right, yeah.
Without him, we wouldn't have a dog.
The tricky thing is there are no road signs that are directed to where the milk is, but you'll watch Mum will nudge her, and she'll almost instinctively know where to go as well. But it's a slow road, a few speed humps.
The tiny filly has been named Iris.
Hey, oh, you spring up, don't you?
And once she finds her feet, she also finds the target.
There you go. Mum's pretty happy about it. I guess after all the worry in getting here and making sure everything was okay, to now see a stunning foal in front of me, taking her steps with milk in her belly and a contented mum, what more can you ask for? Good night, Harriet. Good night, little girl. Well done, bud.
You gonna go up? Come on.
At the Bondi Clinic, vet nurse Tonya has arrived for work with her pet ferrets, Baby and Jack.
Sarah brings in her dog every day, Neil brings in his dogs. I bring my ferrets and Mel brings in her rats and her bunnies, so it's awesome. We all get to hang out with each other. It's a really good environment.
Good morning, Mrs. Carswell. It's Neil here from the vet hospital. I'm just ringing to let you know I'm just coming around shortly to pick up Charlie, and Dr. Chris Brown will be coming in to say hello to you.
How do you think Charlie's going? To me, he looks he's certainly getting worse.
He's definitely deteriorating.
Neil and I are picking up little Charlie today. He's a delightful little 9-year-old King Charles Cavalier Spaniel, but he's got a really serious heart condition, and there's no cure. It's got that real tropical feel, doesn't it?
Charlie's owner is a favourite at the clinic, simply known as Mrs. Carswell.
Hello, Mrs. Carswell. It's Neil here.
Hey, Charlie, you're our boy.
The sick Charlie and his mate Mr. Bojangles are the centre of the 88-year-old's existence.
Just seems though Mrs. Carswell can't actually hear us.
Just coming.
Yes.
Hello.
Neil and the other staff often run errands for Mrs. Carswell, and we've even made up this chart so she can follow all the medication that little Charlie needs.
And the sugar and the Panadol you wanted.
Oh,
I'll pop those in for you, okay?
Thank you so much.
I'll just pop those there. She's an amazing lady. She really takes great care of those pets. It's a bit worrying for me, I suppose, sometimes, because I worry whether she's taking care of herself.
In the past, Charlie and Mrs. Carswell have battled for dominance.
Very regal.
Oh yes, he's very bossy little bastard, to start off with. But the older he got and the more he needed affection, and realised that he didn't depend on me.
Yeah. Now, Mrs. Carswell is as eccentric as they come, but an absolute joy to be around. You never quite know what you're going to get with her.
I think he's existing on a will to live.
Charlie has a leaking heart valve which can't be fixed. It's now just a matter of time.
Okay.
Come on, Charles. All right, that's it.
Each week we take Charlie to the clinic to drain all that fluid from his abdomen. It's just to try and relieve the pressure on his circulation because his heart is already struggling so much. He's so special, and obviously so is Mrs. Carswell. And yeah, we go that extra mile for them. Come on, sweetie, come on. Good girl, good girl, good girl.
At a nearby park, Angus is taking his 8-month-old puppy Rosie for a walk.
I can tell the little flippers start to get tired.
Every day, that's becoming harder and harder for this severely deformed golden retriever.
The problem with her paws has deteriorated. I can see that she's finding it more difficult to walk on those paws.
2 weeks ago, Angus saw an ad selling the dog for $100. He soon found out why she was going so cheap.
I knew something had happened to her paws. I wasn't sure whether it was trauma or maybe a congenital thing. The owner at that time told me that he hadn't fed her properly, and so I was perhaps wondering whether it might be rickets.
Despite her disability, Angus fell in love with Rosie.
I think it was a case of love at first sight. She chose me and I chose her. In terms of Rosie's future, she certainly can't exercise as a normal dog, she can't get upstairs, and I just think those things are going to get worse.
Following a check-up at the Bondi Clinic, Rosie has been referred to the Small Animal Specialist Hospital, SASH.
Come on. So I'm determined to do what I can for her. Good girl, Rosie.
Oh, there it is. Stuck right across the back of his palate.
At SASH, vet Lisa Chimes is dealing with a Springer Spaniel in serious trouble.
Ouch, are you going to let me grab that without sedating you?
Obus has a bone wedged in the back of his throat. Getting it out is going to be difficult and painful.
Generally, dogs don't let you put your hands in their mouth, particularly if there's something stuck in there and they're distressed about it. So often they will have to be sedated for it, but Obus seems like he's got a pretty good nature, so hopefully we'll be able to do it conscious.
It's okay, darling. Shh.
Okay.
Oh, shh.
Next on Bondi Vet, precision surgery to fix Rosie's crippled feet.
It's very major surgery, especially for a young dog.
And Chris gives Charlie the chance to live another day.
His heart's just really doing its best to keep up, and unfortunately it just can't really keep up enough.
Good. Nice to meet you, Andrew.
Thank you. Yeah. Come on in.
Okay, sure. And this is Rosie.
Look at those legs. Come on, let's have a look at you.
At the Bondi Referral Hospital SASH, Angus meets specialist surgeon Andrew Marchevsky to see what can be done for Rosie's deformed legs.
What you're going to find with her is we'll end up putting some frames on her legs and essentially breaking a leg or cutting it, the bone, which will allow us to sort of gradually straighten it out and lengthen it. But as I say, we'll take some x-rays and we'll see. It's serious in the sense that I think it's life-threatening if it goes on for much longer. She won't be able to walk around, she'll be in chronic pain, and from an ethical point of view, you just wouldn't be able to keep her alive.
X-rays show Rosie has a bone disease which has damaged her growth plates. This is an extreme case.
The good side about all this is there's something we can do. The downside is that it can be quite expensive.
Yes, yes.
And I think your $100 dog is going to turn into something a little bit more than that.
How am I going to get the money together for this operation? A very, very good question, but I'm going to have to talk to family and friends. I'm going to have to go into debt.
Oh.
Okay, see you, Rosie. See you later.
Come on, Chucken. You and me. Come, Rose. Good girl. Good girl.
You know, it's a lifetime commitment taking on an animal, and it's something now that I feel I have to take some responsibility for.
There we go. All right, hon, we're going to make you feel a lot better.
In the treatment room, Lisa and Nurse Victoria are struggling with the stuck bone.
Okay.
Nothing is working to dislodge it, and Obus is becoming more and more distressed. Lisa doesn't want to sedate him, but she's running out of options.
It's okay, darling. Good boy, Obus. Good boy. It's pretty stuck. Good boy. Oh, you're very brave.
Oh,
very brave.
Look at that.
Oh my God. No, you don't want to eat it again.
It's pretty sharp on the edges. There's a bit of controversy over whether you give a bone to a dog, but definitely no cooked bones. And with raw bones, I would be supervising the dogs while they're eating it and give the bones according to their size.
Good boy, good boy, good boy.
We've got little aliens swimming in water, but they are actually intestinal loops.
Chris and Neil have just picked up the terminally ill Charlie from his 88-year-old owner, Mrs. Causwell.
Each of those lines there is 1 centimetre, so we've got 1, 2, 3 centimetres of fluid.
The ultrasound graphically shows the fluid that has flooded into his abdomen.
He's got a leaking valve, so each time his heart pumps blood, some leaks back through that leaking valve. As a result, he gets a build-up of fluid in his circulation, which you can see here. That's why he looks as though he's had a few too many pies down here. But that's just all fluid. Now this is actually going to cause a bit of coughing too, so we don't want to do it for too long. It's a very big heart, at least 8 centimetres across for a small dog. I mean, it's almost a balloon that's sitting in his chest. Sorry, puppy. He's just got this huge heart that pushes up on his lungs.
So how big should it be, Chris?
Probably 2/3 that size, even half that size. Okay. His heart's just really doing its best to keep up, and unfortunately it just can't really keep up enough.
The motorised suction pump is like a vacuum cleaner, sucking out nearly 2 litres of fluid from the spaniel's bloated belly. It gives Charlie real breathing space, keeping him alive.
Just always in amazement at this process. He's only 8 kilos, yet Charlie each week produces over 1 litre, almost 2 litres of fluid. It's amazing he has the energy to even produce that fluid, let alone keep on living. He's just a little wonder.
It is hard watching him deteriorate. You know, he's such a lovely dog. He had lots of personality. It makes me sad just thinking about it.
Oh, look at you.
In the operating theatre at Sash, Rosie's major surgery is about to begin.
In a month or so, she wouldn't have a life because she just wouldn't be able to walk around. This surgery will be life-changing for her.
Her owner Angus has managed to come up with the $6,000 for this complex operation.
All right, let's go. When I'm actually breaking her leg or cutting the bone, that's got to be just right.
During this extreme operation, Rosie's front legs will be broken.
If you were a human, you'd be in hospital for weeks after this. So it's very major surgery, especially for a young dog. So we're just about to put the frame on the bone.
Metal rods will be drilled through both legs into adjustable frames. Rosie's legs will then be slowly realigned and straightened.
In a couple of days' time, we'll start winding this, and so that will take that angle of that ring from there, like that, and that will also change the angle of the leg from that to that.
It's not enough for Andrew to be a specialist surgeon. He has to be a whiz in geometry as well.
That alignment's pretty good, so that's about right height-wise, so drop it a bit. Very fiddly work, yeah, but you can overdo it. You sort of become obsessed with making it look perfect, and it's just not going to happen. I've learnt that. I'm not perfect.
2 hours later, and Rosie's new leg frames are finally in place.
So now what I'm going to do is break this radius so that we'll be able to straighten the leg out gradually over the next couple of weeks. 3.5 hours later, and it's gone very well. I mean, this part of it's finished, absolutely, but as I said, Angus's part starts now.
Coming up, Chris tackles an unusual house call. And a shock for Angus after Rosie's big operation.
Yeah, speak up. It's probably the most exclusive residence you'd like to do a house call to. Very flash.
After treating Charlie, Chris is off to see another senior citizen at historic Vaucluse House.
I always get nervous whenever I see my special lady.
Yes.
Well, there she is now. Let's try and catch her and see how she's looking up close. Oh, good step. That was a good step. Okay, you want pace? I'll give you pace.
Naomi, who cares for the animals on the estate, has asked Chris to check up on their resident pensioner.
I just think it's incredible how old Lady is. Goats in the wild will only live to around 7 years of age, whereas Lady's 18 or even 19. She's got to be some sort of record breaker. Oldest goat in Australia, oldest goat in the world, who knows, but she is incredible. So looking over her, she's actually doing okay, but the issue seems to be down here, in this lower part of her leg here. So that joint is basically seized up.
Full difference.
Yeah, I mean that one's quite loose.
Floppy almost in comparison.
Exactly, whereas that one's just rock hard. So that'd be arthritis. You can actually see how her front hooves are bent over, which makes her walk like a muscle man. Now, the issue with that is that she's actually going to start wearing down just one side of the joint, and eventually arthritis is going to take hold, and she may, in the future, just not be able to walk at all.
13.
At Sash, Rosie's epic operation is over. Her deformed legs have been broken. Now her long road to recovery begins.
She's going to be sore, so we'll be making sure that she's got plenty of pain relief on board, that she's got plenty of padding around the pins and the leg. Can you grab me the bolt cutters, please?
Yep.
The metal frames on Rosie's legs will need to be adjusted every day for the next 3 weeks. It will then take the fractured legs another 6 weeks to heal.
A long journey for Rosie and Angus. To be honest, I think Rosie will probably cope with it better than Angus will, but we'll see.
Oh, wow. Rosie.
Hey, Rosie, who's here?
Oh, Rosie.
So we just want to... She gets stuck, you just need to sort of move her little...
Despite being warned, Angus is shocked by Rosie's condition.
I'm a bit spun out, to be honest with you. God, she's been through a lot. Oh, no. Sorry. I didn't expect to cry. I don't cry very often, so I'm sorry. Okay. You're handling this better than me, darling. That's. I bet you weren't last night, though. You're a good girl, Rosie. You're a good girl. Oh, darling.
At Vaucluse House, Chris is checking out a serious problem affecting Lady, one of the world's oldest goats.
There's no point being gentle around here. So we've confirmed it's arthritis, but she's still got one underlying issue. She's walking unevenly, so we need to do something about that. Yeah, okay, look, I agree. She doesn't look as though she loves the whole power tool idea. She's almost giving me this look, what are you doing now? But it will help because it's going to even off those hooves and make sure she distributes her weight evenly. We do this quite often on cows.
Okay.
And occasionally on horses. They put up with the noise. But yeah, we could say it's an Australian first on a goat.
Next on Bondi Vet, Rosie's tough rehabilitation begins.
And you've got to make sure you're going the right way. But you don't want them getting worse.
And Mrs. Carswell reveals a mystery pet.
And it was your Mickey.
My Mickey.
At Sash, Rosie is back on her feet.
She's a great little patient, and she's lovely and great temperament, and she's a good candidate for this sort of surgery because she is so accepting. You're not a lightweight, Rosie.
Her legs are now being straightened in metal frames, and Surgeon Andrew is about to show Angus how to adjust them at home.
I've got a little wrench here which you're going to have to take home with you. You're going to be a bit of a wriggle-wart, aren't you?
Now I've got to go clockwise,
That's
so
right.
going this way. So
That's
I've got
right.
the one there. So if I just 1, 2,
and you've got to make sure you're going the right way. Sounds a silly thing to say, but you don't want them getting worse.
Yeah. Okay. Here we go. Here you are, Rosie. Time to go home.
You are just looking at me going, why am I lying on the lawn? What was that sander and what has today been all about?
At Vaucluse House, Chris has just finished giving Lady a power tool pedicure.
Thank you very much.
Hopefully, it'll help alleviate her serious arthritis.
Let's test out the new shoes, huh? Come on, girl. Up you get. Up you get. There we go. Very flash.
Oh, look at that running.
See, she's going okay though. I think she's definitely moving more freely.
I'd have to agree.
The pedicure seems to have worked. Lady will also be getting dog arthritis tablets hidden in her favourite food, green beans.
Oh, she can't resist, can she?
You're a healthy living, green eating bean muncher, aren't you?
Before he leaves, Chris catches up with one of his former pets now living at the luxury estate, Mercedes the chicken.
You ever seen a chicken hypnotised?
I've heard that you can do it.
Yeah. So what you do is you lie them flat, you tuck their head in, and you just stroke them down the middle. Hypnotising chooks is a real art form. They might look as though they fight it a little bit at the start, but eventually they enjoy it. They go into this deep state of relaxation. And I've got to say, Mercedes is one of my best subjects.
You can do this to any chicken.
Yep. Mercedes, you're making a goose of yourself. Get up. I'll just clean up that little wound a bit.
At home, the convalescing Rosie is getting around-the-clock attention.
Good girl.
Angus's other dog, Gus, keeps a constant vigil by her bedside.
Sometimes I find myself smiling because she looks like she's got little, floaties on it. So, and that's the truth. It's just, it's really weird sometimes. Sometimes you feel very sad, and then sometimes you have to smile. Like that. Rosie, good girl. As each day goes by, I'm seeing a little bit of an improvement. I don't think she's in a lot of pain, so that's been a real relief for me too. Rosie.
After Charlie's sleepover at the clinic, Chris is escorting the King Charles Spaniel home to reunite with Mrs. Carswell and Mr. Bojangles.
Hey, Charlie boy, look who's here.
Oh, look at my little Charlie.
It turns out the octogenarian has plans to never forget her little spaniel, just like her last dog, Mickey.
Mickey's in there, and I say hello to Mickey in the morning, He's never replied, never. Remember this vividly, the man walking up those steps with this dog in his arms.
And it was your Mickey?
My Mickey. And it was so nice to get him back even like this.
Yeah. Apparently he was stuffed by one of the museum taxidermists, so he's got this sort of rather aggressive, wild tone. But the taxidermist didn't realise he's a family pet, not a wild animal.
He's dropping a bit of hair.
Oh, he collects the dust, obviously. I think he'd survive a vacuum cleaner job. Would you do the same thing with Charlie?
Absolutely, because they're not people to me. I mean, you don't do that to people either. Hardly. Fancy having a house full of sort of corpses. Wouldn't that be something? Oh dear. But you're gonna stick around, be my buddy, aren't you, darling? My little doggy.